Today I will be showing you how to administer a Foley catheter and take out a Foley catheter for a female patient. First thing you're going to do is gather up all of your supplies and then go into the patient's room. Knock, knock. Hi, my name is Haley and I am going to be your student nurse today. Your provider has ordered that you must have a Foley catheter. Are you still fine with having that? She says yes. We will then also make sure we have a working, clean area to set all our stuff on. And we will ask her a couple questions, date, time, and why she is here to make sure she is oriented enough for this procedure. If she has given me all the correct information, we will then move over and get our supplies ready. The first thing we are going to do is make sure her head of the bed is rose up to the proper working condition. We are then going to make sure we do hand hygiene, and we are going to take our biohazard bag and put it on the floor for trash. Mine's already there as we speak. The next thing we will be doing is taking the sheets and putting them down at the end of the bed. Then we will also be raising the gown to proper working level, making sure we have provided privacy by shutting curtains and windows, and as well as just making sure we follow their dignity for this. The next thing we are going to do is lift their legs and make sure they are spread them out and make sure they are in a proper position. Now the next thing we're going to do is get our sterile field ready. We're just going to take the packaging out, toss that into the trash, and get our field ready. The first thing we're going to do is pull farthest away, then do the corners. And then pulling closest. The next thing we are going to do is apply our sterile gloves. The next thing we are going to do is start by applying the draping. We will first pick up our blue drape and let it unfold on its own. And making sure we have the shiny side facing down. Making sure we do not touch the legs or our gloves will not be sterile anymore. We are going to then take our other drape and also let it unfold on its own. And we are now going to place it at the working area. The next thing we are going to do is start by preparing our sterile field. The first thing I am going to do is by taking out our alcohol swabs by the stick end. We're just going to toss this in the trash. Then we are going to apply our lubricant before tossing that as well. Now we are going to connect our fluids to the catheter. We're going to take this off. And we are then going to take our syringe and then put it into the catheter. Now we are going to take the covering off of our catheter. We are going to slowly take it out and making sure when we take it out, we don't fling the catheter around. Now we are going to lube up our catheter. Now we are going to leave it there as we will now begin cleaning. We take one of our alcohol swabs and we are going to clean farthest to closest to the middle with one swipe. Farthest, toss it. Take another one, closest, toss it. And then with our final one, we will go directly down the middle, one swipe, and toss it. Now we are going to tell our patient to bear down like they are voiding, as we are going to then start by administering the catheter. We are going to spread the labia and remind them to bear down like they're voiding, and if there is any discomfort at all, to let us know, and we will stop the procedure right away. Now we're just going to insert the catheter. And now we are going to start by inflating our balloon, making sure we slowly administer the fluid. Now we are just going to disconnect. We are going to set this, we would usually put this in a biohazard bag, but we are going to sit this on the table for later. We are now going to make sure to give a gentle tug to make sure that the balloon is inflated. We are then going to take the remaining part of the catheter and we're going to tape it. And now we are going to take the bag of the catheter and we are going to put it on the hook ends of the bed. And then we are going to now start by cleaning up our sterile area. We are going to rip the draping and gently pull it under, pull this out, and then we will start by throwing all of this into the biohazard bag. And we are then going to take our gloves off. Tossing those as well. And then we will provide privacy again for our patient and tell them it's going to be a little discomforting for right now, but it'll go away soon. We then leave them, and then 3 days later, the provider asks us to come back and take out the catheter. So the first thing we're going to do is our initial steps. We would also, before coming and taking the catheter out, we would make sure we would be charting the procedure and if there was any pain or discomfort. Now, we would come back and say, "Hi, Ms. Smith, it's Haley here, student nurse. The provider has now asked us to come and take out your catheter. Are you okay with that?" She's fine with it. We would check her orientation again, and if she is good, we will start by doing the procedure. We are first going to do our hand hygiene, and we are going to be putting on our clean gloves. If that were to happen, we would change our gloves immediately to protect any bodily fluids getting onto our bare hand. But seeing as I don't have another pair, we will just pretend that these did not rip. Now that we have our clean gloves on, we are then going to start by cleaning up any fluid or anything that has come out from the catheter. And we are going to start by taking the catheter bag and we are going to empty it. We are going to empty it a graduated cylinder, hold it up at eye level and check the amount and color and odor and what the consistency looks like. We are now then going to put this back on the hooks for right now. And we are now going to start by taking the catheter out. We are going to untape the catheter. Just going to toss that. And we're going to do the same thing again, tossing that in the trash. We are now going to take our clean syringe and apply it back onto the catheter and start, as you see, letting it do its own thing as it will start deflating the balloon on its own. And once it has reached its fluid max, we're just going to pull back a little bit just to get any excess out. Now we are going to remind them that this may hurt a little bit, just to bear down like they're voiding, and it'll only be for a quick second, as we would then start taking the catheter out, making sure not to fling it everywhere. We're then going to take the catheter bag and the catheter, and we are now going to place it in a biohazard bag. We are then going to take off our gloves, toss them in the trash. We would then make sure to cover them back up and put them back down in the lowest position, and remind them that going to the bathroom for the first time after having a catheter will feel weird, and to report any unusual findings to the nurse. And then we would go and chart our urine output and how the procedure went, and if there was any discomfort during the procedure.